Okay, so a birth plan is really important. I like to call it a birth preference because as a plan, that sounds like a very rigid, organised, predetermined idea of exactly what is going to happen, when in fact birth has many variables. And I think birth preferences is a much kinder and softer and gentler way of planning what you would like to happen. So with birth preferences, ideally what we're going to do is we're going to think about the environment that you want to create in the birthing room, whether that be bright lights and loud music, whether that be soft lights and soft music. We're going to talk about important things like, are you going to want to have your placenta encapsulated? Are you wanting to have delayed cord clamping? Is Dad going to cut the umbilical cord? Is Dad going to announce the sex of the baby? How do you want to manage any discomfort? Do you want to manage that in a shower situation or in a water birth situation? Are you wanting a water birth, or do you want to be birth on the floor on all fours? All of these things are, things to consider and are part of your birth preferences. I also like to encourage you to have a B option, so that if things don't go according to plan, then we're going to look at the medicalised influences that may be necessary, understanding what an epidural is, what a forceps or ventouse delivery is, and what is a caesarean, and how do we manage those. If things don't go according to your first preference, then we've got a good understanding of a second preference. We're going to talk about what happens to Bubby if Bubby's not responding quickly to post-delivery. What happens? What is resuscitation all about? What happens there? When does Bubby have to be weighed and measured? And what about inoculations? Do you want Bubby to be injected with hepatitis B vaccine? Do you want Bubby to have vitamin K? These are all topics that we talk about, so you can make your decisions based on what preference is right for you.